This conference will now be recorded.
Hello, you can start.
Yes. Hello, I'm Dr. Forum, one of the doctors in the emergency unit today. Can I please confirm your name,
Yeah, my name is Maria.
Maria? And can I please confirm your daughter's name and age?
Her name is Emily, and she's 16.
Okay.
Doctor, I just want to know what's happening to her. Why did she just collapse at home? Is it something we need to worry about? Because I've never encountered this sort of a situation. What is happening with her?
I understand your concerns, Maria. I will just ask you a few quick questions, and then I can tell you a bit more about what is happening to Maria and what is happening to your daughter and how can we further manage her. Is that all right?
Okay, yeah, fine.
So can you please tell me exactly what happened to her and yes?
Well, I don't know. She was just everything was fine, and she suddenly I found her complaining of some mild abdominal pain since about 2 3 hours, and then she just fainted, and we got her here, and everybody was just running about, and the way that they are behaving around her, I feel something seriously gone wrong. Uh, Please tell me that she's going to be okay.
Oh, definitely, your concerns are valid, Maria. Just please rest assured, me and my team of doctors are here to support you and your daughter, and we'll do everything we can to manage your daughter as well. So, you told me she had pain since the past 2 to 3 hours. Did she mention how much was it? Was it severe, or where was
No,
it?
she was just saying some pain in the lower tummy, and I was going to take her to the hospital, but I got a little stuck up. And meanwhile, this just happened. So I don't know.
Okay. And did she complain of any bleeding from down below or anywhere else?
No, I don't think so.
And did she have any vomiting or dizziness?
No,
Okay. And did you feel that she was weak in the past few days?
no, doctor, nothing was wrong with her. Seemed
Okay.
fine.
And okay. And are you aware about when was her last period?
No, I'm not. But the thing is that me and my daughter used to be kind of close to discuss all of those things, but she's on one of those phases and she's like kind of very withdrawn from me these days and doesn't really discuss anything. So I don't know what's going on.
Definitely, your concerns are valid, and there can be those phases when a girl reaches the teenage years. Also, I would just like to know if your daughter has any boyfriend or any partners, as you told me you are close to her.
No, doctor, we consider all of those things, very wrong because I'm a devout Catholic and I don't think that, we should be considering that.
Okay, definitely. And can you please vouch how's your daughter's behavior at home or at school?
Like I told you, she was a good kid, and she is a good kid, of course. But she's been keeping to herself lately. Barely talks to me. I don't know. I'm not able to connect with her so much.
Okay, I'm really sorry that that has happened between the two of you. Also, I would like to know who all live together.
It's just me, my husband, and her.
Okay, and is she like your and your husband's biological daughter? Just to confirm, I'm sorry, it may sound a bit personal, but I'm really sorry.
Yeah, of course. I mean,
Okay,
yes.
and what about any other medical concerns? She might have?
Sorry?
Any medications that she's already on?
No, no, she's not. She's perfectly healthy kid.
Okay, any previous history of surgeries?
No surgery.
Okay, any family history or personal history of bleeding or clotting disorders that she might have?
No.
Okay, and do you think she has any habit of smoking or alcohol use? I'm really sorry to ask, but we ask generally
No,
all.
no, I don't think so. But honestly, like I said, that she's been
Yes.
keeping her distance now.
Um, and do you know if she has any allergies?
No,
Are you aware about her weight to hydration?
it's 24.
Okay, and her blood group?
be positive.
Okay. And do you think you or your daughter have any objections to blood transfusion?
No, that's not an issue.
Okay. Okay. Thank you for
Is she
answering.
going to need any?
Sorry,
Is he
Maria.
going to require blood? Is this that serious? What's going
Uh,
on?
Yes, I understand your concerns, Maria. As I told you, your daughter came here because she was unconscious, and then when we examined her, and we had done an urgent ultrasound for her as well, and we found out that there was a mass in her tummy, and it was bleeding profusely, and it is still bleeding. So there is collection of blood in her tummy, and so we started to give her some fluids through her vein so that at least we could resuscitate her, but still her bleeding is not being able to control it, and we need to take her for an urgent surgery. Are you with?
Oh, okay, but how would this happen in a perfectly healthy kid? I mean, I just don't understand.
I acknowledge your concerns, but there could be a number of reasons why this is happening. But at first, her safety is our topmost priority. So we need to take her to the surgery urgently, and we may need to open up her tummy, and we need to see from where this blood is coming, and we need to control that at the moment. And once it is controlled, and once your daughter is in a stable position, and then we can discuss together what must have happened and what is causing these symptoms of her. Are you with me?
Yeah, doctor, if you feel operation is the best way forward, we can do that. But I just need to understand if she'll be okay.
Uh, yes, Maria, I understand your concerns. You are concerned for your daughter, and at the moment, operation is the only option so that we can identify from where she is bleeding, and we can get the bleeding under control. And once she's stable enough, we'll have to open up her tummy, go to where the site is bleeding. We need to control the bleeding. If at all there is any important structure from which the blood is coming, we may have to remove that structure as well. And as it is a surgery, it can have some complications like risk of infection, risk of injury to the surrounding structures, and she may need a prolonged stay. And as I mentioned, we'll send her investigations of her blood count, how her kidney and liver are functioning, and also how her blood is clotting. And if at all we need anything, we may need to give her some blood and blood products during or after the surgery as well, depending on the results. And once she is shifted to the post-operative ward, and once she's stable enough, then all of us can discuss together what may have caused this complaint of her, and how we can manage her better in the future as well. Okay. I'll just, if that's okay with you, I'll just go through the consent form. And as you are her next of kin, you can sign the consent form for her, as it is an emergency laparotomy and it is for the best interest of her as well. And due to some
Okay.
confidentiality results, I'll have to ask some things to your daughter, and then we can disclose all of her things with you. Okay.
Okay. Okay. What does that mean? I mean, confidential. I mean, I'm her mother. I have every right to know.
Yes, definitely. It is your right to know about the things going on in your daughter's life, but you have a right to know from directly herself. We, as healthcare professional, have to follow the patient-doctor confidentiality. Whatever your daughter has and whatever your daughter discusses with us, we cannot disclose to you directly, but we'll encourage your daughter to tell you everything.
Okay. Now this is sounding a bit scary for me, doctor. What's really going on?
I'm really sorry, Maria, that you're feeling such a way. It is definitely your right to have concerns about your daughter's health.
Mm.
But once she's better, we can discuss everything together. Okay?
Okay, okay. Whatever surgery is required, you can proceed, doctor. It's fine. I want what's best for my daughter.
Yes. Thank you so much for your consent. I'll give you the consent form, and then you can sign it, and we'll start shifting your daughter for the emergency surgery. And I'll inform my consultant for her same as well. She would be managed under a team of doctors, including my consultant, her GP as well. the laboratory doctor, specialist, imaging doctor, and counselors. Once she's better, we'll talk together, all of us. Any other concerns I can answer?
No, that was fine.
Okay. Thank you. Thank you so much for your time, Maria.
Okay. Any reflection, Dr. Fora?
Um, I did not know, like you mentioned that the patient had been acting withdrawn and away. So
Mm.
like, what else did I have to ask regarding that history?
Okay,
And
but at least you caught on that in the first instance. That is something we can appreciate. Yes, let's take inputs from others who were listening in as well. Um, Nitisha, were you there from the start? Nidhi, Dr. Nidhi was there from the start.
Yes, ma'am.
What do you think?
Ma'am, I think she did pretty well.
Okay.
And but in case I was in doubt whether we should actually bring up the topic of this
Mm.
confidentiality or not right away
Mm.
by taking a consent.
Okay.
Like I would have just told her that there's blood in the tummy and we need
Yeah.
to take it out and look for the cause and then. So whether the
Yeah.
topic of confidentiality should have been touched here or not, that is my concern.
Yeah, exactly. She was doing quite well till the time that she said that there are certain confidential things which I did not. Why are you going digging your grave in that area? Because you are making her suspicious. Rather, you can put it in a different language if there is something that you don't or are not allowed to discuss within the scope of what's going on. Then you can say that as we know more information and once your daughter is fine, we can discuss the findings of the surgery and whatever happened with her as well as you if later at a point of time we can all discuss together after we have discussed with your daughter, of course. At this point of time, all I can tell you is that there is a need for an emergency operation because her condition is serious, etc., etc. Apart from that, do you think anything in normally if a patient had a ruptured ectopic and was being taken and you're consenting her, what all information would you give in applied clinical and patient safety? Just
so,
that you require laparotomy of this
and
or something
so,
more that you
so
want to
chance
tell?
removal of the tube, recurrence.
You can't tell because you've not disclosed that information. But other
Blood
than that,
transfusion?
blood
Blood
transfusion, of
transfusion.
course, yes, yes, yes. Then
Um, uh, in
we'll first look at the simpler aspects, which are very easy to understand in applied clinical and patient safety, which you would do for any patient who was even conscious. So, for example, if this girl was, you know, speaking to you at this point of time and she was not unconscious, what you would have told her is that we will have to do an emergency operation whereby we'll be making a cut and all those things, and I will coordinate. Your condition is quite serious. All these things are there. There is ongoing significant amount of bleeding which has happened, and what we require to do is go in. We need to take the tube out and stop the bleeding immediately, and um, uh, after that we will also have to consider the need for a blood transfusion. It is very likely that she will require. No? She has collapsed. So, and that is one thing. And after that, you have to discuss what happens next, like what other care she will receive. Till then, we will resuscitate with IV fluids, give appropriate antibiotics to her after checking for allergies and all those things which you are telling generally also. You have to tell the standard format of care or your approach, clinical approach here as well to the mother. This is easy to understand in applied clinical knowledge. But other than that, there was something in the task as well.
HDU care? HDU shift to
HD,
the
yeah, exactly. I mean, we shift, then we'll shift to HDU. We'll continue monitoring on mirrors. Okay, I will have my colleagues in the theater, okay, who will coordinate with the blood doctor and the scribe porter, whoever, and also the anesthetist, okay. All these people will be taking care of her. So this, like, I'm talking about clinical management, which you generally also tell.
Hmm.
You will mention here, no doubt about it. Um, about the consent, what are your opinions about consent? Is it parental consent now that it's a 16-year-old who's unconscious? Who will sign the consent, and what will happen if somebody refuses to sign consent, for example?
It will be in the best interest of her, as it is an emergency procedure.
Right, you can proceed even if you don't have anybody to give a consent for you. But given the scope that it's a child, and between the ages of 16, 18, there still is a possibility, since we consider that we are the exam is mainly in context of UK. You can explain to the parent. You can take the scope of the consent will be that of a laparotomy and exploration to look for what is causing hemorrhage. And of course, as you have explained, other injuries, etc., etc., which may happen, anesthetic complications, which may happen, pain infection, bleeding later on. All these things will come under the purview of that consent, other than specifically mentioning that it is going to lead to a self-injection, most likely. Okay, so there are times as such, no, for laboratory procedures signing for that.
Voice is breaking, ma'am. Hello, can't hear it. Hello.
Training for everybody.
Yes, ma'am.
Yes, yes.
Yes, ma'am.
Okay, what is the last thing you guys heard? Is it okay now? Is it okay? Is it better now?
Yes, now better.
Okay. All right. So when we talk about explaining the clinical aspect of things, that's where your applied clinical marks will be. However, as you rightly pointed out, she kept repeating herself on one particular point. What was that?
Like she was withdrawn and do whatever is good for her. And
Yeah, she's basically somebody who's kind of closed up now and not communicating as much. And she used to be quite close with her. So when the role player is saying something like this repeatedly, it's always a good idea to probe into this, don't you think?
yes.
So what do you think you could have like asked or done?
So maybe after what event she was feeling such if or
Um, no,
uh,
not maybe in general. What specifically is the thought in your mind? Then we'll see how to phrase it.
if she has had some result of assault or abuse.
Right. So you suspected that, no?
Yes, that's why I
So
asked if she has any stepfather or any partner or at school or her behavior, but everything was okay. So I did not know what
no,
else.
you asked me if she had a boyfriend, and I said that usually I would not permit that kind of behavior.
Hmm.
But that does not mean that. And then I followed that answer up by saying that she's not really talking to me now. Right. So when such a thing happens, you need to probe a little. Anybody has any suggestions, maybe how we can proceed in this situation? Nitisha.
Ma'am, I'm in OPD, ma'am.
Ah, okay. Fine. So anyone else?
Yes,
And
ma'am, we can
again,
ask her.
mm,
Like, what does she think? Why does she
mm,
think that the child is getting withdrawn? What are
exactly.
his
Yeah.
her
What are
feelings?
her thoughts about this particular thing? This is the easiest way because she might have, see, like when somebody is having a hidden agenda or they're hiding certain thing from you, okay, and they have doubts or things in their mind. which are coming up. Like, for example, when if we are talking about somebody who has postcoital bleeding and she's like, I'm anxious, I'm worried, I'm worried.
Hmm.
You ask her, no, what exactly is that you are thinking at this point of time? Same way you have to ask this mother also. Why do you think that this is happening? Any particular reason why you feel that she's behaving this way? Yeah, so moment you do that, she'll pretty much be like, I think that somebody is trying to influence her, or older men may be involved, things like this. Now you don't know whether it will be. How can you particularly start asking about each relation in her life? Like, for example, stepfather. If you uh, point blank ask that, it's like an assumption that you're making that there is abuse from just like one person. But you want to
Hmm.
be as open as possible when you want to gather information, correct?
Yes.
Yes. So when you're doing that, you or the role player is saying anything which brings any suspicion to your mind, please ask them straight. What do you think is the reason why this is happening, or any particular worries that you have with regards to this behavior, why it has come up in the recent times? Rather than saying that, oh, when you kind of, reinforce that, okay, teenagers behave this way, I think that that was an inappropriate thing to say, rather than in the
Yes.
given the circumstances, because although they can, and you can many a times reassure that this behavior can be normal, not probing into it would raise a lot of red flags in the exam for you.
Yes.
Okay. Okay. So although she has this, and she thinks that her kid is a good kid and she would
Hmm.
not do anything wrong as all mothers would, and that she's given her good upbringing, but she's still worried that something is going on with her child which is not behaving normally. So if that was disclosed to you, then certain aspects of the task would change. Okay. For example, what else would you? Okay, I can tell you now the reasons why I would have to cut your marks in applied clinical. I have already told you. In patient safety, I'm telling you now. Okay, it
Hmm.
was because of this suspicion of abuse that she has. It's not a clear-cut abuse, and she doesn't know. She's just also thinking about it, right? But at the same time, if this thought process is there with the mother, is there anything else that you can say, and how would you say it without breaching confidentiality?
Hmm.
That is what is the question.
Um, we can.
Hmm?
Uh, there could be a number of possibilities. No. Mm,
Yeah, give it a shot.
uh, so, as
Well, ma'am,
you.
we can,
Yeah, tell me.
okay, ma'am, we can tell her, okay, like we can look into this cause also, but details will be indulged only after your daughter regains consciousness and we discuss with her, and further discussion can be only taken up after her consent.
Yes, further discussion can happen only after her consent, but at the same time, the mother is raising a safeguarding issue to you, right? She said that she's been groomed by some, yes, Dr. Preeti, she's been groomed by some older men, or she's influenced by some older men, okay, which may be there in her life, or some abuse is going on. So, in this context, you can still advise her if that's something serious that you have raised here, right? And you can tell her that what steps will be there. Of course, after the operation and once she's stabilized, we can discuss further about what exactly happened. But since you're worried about this, then we can also help you out with regards to informing the hospital safeguarding team, who can take investigate further into this, and of course take measures if they feel that they can help you out in any form, including informing police. Okay, so all these things we can help you out with your daughter. Please don't worry about that. And additionally, you have to also be advising a mother who is at this in this vulnerable girl, okay, about the need to be aware that even in these situations, younger girls, they are susceptible to being sexually active, and what she needs to do as a mom. okay, to be able to communicate with her better. Okay, so you will probably advise counseling for both of them, all right,
Hmm.
and maybe able to open up about her, and we can open up communication between the two of you. It is very important that we educate young girls, okay, in this age group, and also it is our responsibility to protect them. They I'm not in particular about your daughter, but younger girls also can tend to be in this age group sexually active sometimes, and we have to be open to that possibility. Always discuss sex education, safe sex practices with them. Okay, and as well as the need for contraception also. So it is important for us as elders and parents to understand that it is not always avoidable and it can happen. So see, I have not revealed that I'm not committing she's sexually active.
Hmm.
I am advising a mother that there is possibility that her young child could be sexually active, and she's in a sort of a distressed and kind of hopeless situation where her daughter is going to undergo surgery. All right. So again, she'll be receptive. It depends on how you are saying those things out to her, rather than saying that, oh, these people are at high risk behavior. If you put it that way, then of course she's going to shut down the conversation, saying, no, no, my girl is a good girl. All right. But at the same time, you have to say, it depends on how you are communicating this particular point to her. All right. So in this task, communication wasn't very easy, was it? As it
Hmm.
looked. Yeah. So it's kind of tricky about how you put the thing across. I would advise that don't go, as Dr. Nidhi also said, don't, you didn't have to mention about okay, certain things are there which we can't discuss with you without her permission, etc. You don't need to tell that. Okay.
Yes, because I
But
didn't know if confidentiality was in the marking scheme or not. Like if you should.
confidentiality, if you're maintaining confidentiality, you're getting marked for it.
Okay.
Like, the thing is that
Doctor,
if you go and divulge that, oh, she's unconscious, she can't give us consent, but let me tell you that she is pregnant. If you do
please,
that, then you will definitely get a zero there straight away. No further questions asked. Even if you say everything else in patient safety right, you will still fail the task. Okay, but here it dependent on what confidentiality you maintain. Okay, it depends on how you have put across that information. All right, so you can say that at this point of time, the what information I can give you is this much
Hmm.
only. Don't say that it's because of confidentiality or this or that. All right. So we have done this. Your daughter was brought in an emergency situation. Her situation was quite serious, and that we did a scan. There seems to be ongoing intra-abdominal or inside her tummy some bleeding which is occurring. So usually in these situations, unless we go in and surgically stop the source of the bleeding, it can be ongoing. It can be life threatening also. I'm not trying to scare you, but her condition seems critical, and therefore we need to open the dummy up, and we need to take a look at what's exactly going on, and we'll have to fix it. Okay, currently I can it's I'm limited with the amount of information that I can give you and what information I have with me. And so of course after the operation we can discuss with your daughter also, and we can discuss more in detail with you. Of course, you're reassuring her that a further debrief will take place, but that will be after you have taken consent from her daughter to divulge about the pregnancy, etc. Or you will usually have a dialogue with the daughter, explaining to her why it's probably important to involve her parents in this situation also. So it's part of the Fraser thing too. But if she declines it, then no, you can't do anything. You can't tell. Okay, but that's a situation, that's a more complex ethical situation, right? Later. But for now, this much information, yes, you can give her, and you need to explore because there was a concern that she kept telling you about. All right, there's a reason we are doing these exercises now closer to the exam is because things like these will happen, and usually it's things like these that result in person not maybe not doing so well in the task, right?
Yes.
Okay, so yeah. Apart from that, the always signpost before that boyfriend question and signpost before smoking alcohol. You can say something like, we understand that she's a good kid, but often in this age group, in school going kids, smoking alcohol, drug habits are common. Do you think that there is something like this, or does she have a boyfriend? The same way that why you are asking the question, you explain. Okay, your concern behind it and all those things. And of course, any pregnancy related symptoms. So why did you ask if I was biologically related?
Uh,
Why?
and just because I wanted to rule out if stepfather is there or not,
Hmm?
or if she is adopted child or not.
If he's adopted, how did he become stepfather? Stepfather would be if I am remarried again to another individual who's not her biological father, but she's adopted by me and my husband. And again, it's adopted parent. It's not stepfather
Yes.
technically. Secondly, why the father only? I mean, this is called a fixation of an idea in your
Yes.
head, right? You went in with okay, if the father has to be the abuser of this.
I just
Okay,
thought
no,
maybe
cannot be.
boyfriend,
Could be anybody.
but yes, not yes, yes.
Could be a teacher, could be an uncle, could be a neighbor, kid, anybody. So
Yes,
you don't go with these sorts of ideations which are there here. In fact, in the script, she doesn't even know much. I mean, she doesn't know. All she's saying, she's withdrawn from me. She's like, okay, all right. So if you were to say this, then definitely the a patient would get angry and say, "How dare you say this? You don't have any proof. My kid is a good kid, all right," and things like that. But you did not. So all that was quite good. All right. So yes, okay. So communication wise, things were okay, other than what I have told you. That don't mention about the confidentiality bit directly. You say in the way that you're explaining the diagnosis or the situation, in that you can display that you are having confidentiality. Okay. So you need to explain about the urgent life-saving measure that you are going to take and all the surgical risks and surgical procedure, including postoperative and other care that she will receive. You have to explain that this is an emergency situation, just like you would to a patient, the same info. Okay?
yes,
Whatever you would to a patient, like emergency, resuscitation, communication, investigation, management option, the same way that your thought process has to be like this, all right? So that you don't miss out on any points which are there, all right? And
yes.
laparotomy with arrest of hemorrhage, blood, very important patient safety point,
Mm.
IV access, all these things, and just like in all others, you would talk about antibiotics, VT, risk assessment. Once conscious, we'll discuss more about the details of the surgery with her, as well as we will take you into consultation and discuss with you as well. All right. And this can be a traumatic event, so please remember a counselor, and of course, she requires counselors for a therapist for other reasons also, that her daughter
Mm.
is difficult. But we have to escalate safeguarding concerns. Okay, you can
Yes,
see this. Um,
yes,
yeah, okay. All right, so standard protocol, and you need to tell her that these are not meant to punish her, but they are always meant to help a child out in her situation. So, if any concerns like this, then we can always escalate further once we are done with her initial management, of course. That this should come towards like after you have explained the laparotomy and ectopic management, all those things you have done. At the end of that, you mentioned this way, okay? Safeguarding pathways and recognizing the importance of sexual activity in children and to advise safe sex practices as well as contraception to avoid any future also complications and pregnancy as well. Okay, here now another thing you would have mentioned to a patient if you were doing is, can you think?
Um,
You would require to, but here you cannot
like,
technically tell that point because you have not divulged she is sexually active.
yes.
The point
Contraception.
is, contraception, you're telling anyway that, to a mother to recognize the fact that children in this age group can also be sexually active, and it's important to educate them about safe sex practices such as use of condoms to prevent sexually transmitted infections and as well as contraception to avoid pregnancies. But at the same time, the other point would have been about it's an ectopic pregnancy in a younger individual, right? You want to rule out
Okay.
something.
Oh,
Doctor,
STIs. STIs.
STIs, yes, you
Yes.
want to rule out STIs.
Hmm.
So you would want to probably consider taking a swab as well. Here you cannot say that to the mother because that would breach confidentiality. Hmm? Okay,
Yeah.
so good.
Yes.
doctor, I have a
Mhm.
question, please. If
Yeah,
she,
tell
yeah,
me.
please, if the mother already she knows about this behavior, so
Hmm.
is it allowed to tell her that she is pregnant?
She does like be specific. She is suspecting the behavior here that she's being abused, but not confidently. But in your situation, you're saying that the mother comes and says that my daughter is sexually active.
Yeah.
No, you cannot tell about pregnancy still.
Okay.
You cannot tell.
And
If the
and he,
mother knows that she is pregnant, like for example, daughter goes and tells mother, oh, mom, my UPT is positive, and then next day this collapse happens and she comes to you and she says, though yesterday we found out that she was pregnant, then yes, you can tell that this is an ectopic pregnancy.
yes, I mean that if already she knows about her situation, we can discuss openly, and about safeguarding also. If she told us that she is withdrawn, this is mean, or I can ask her about that she suspect any abuse or any uh,
Yeah,
grooming.
yeah, any grooming, abuse, etc. But the way that you will put it across is like any particular reason that you're worried this is happening, or why do you think that she is behaving this way? And we know that teenagers can be a difficult age group to handle, but any particular reason you mentioned that she's, behaving withdrawn from you, what is on your mind? Ask her about that. So that is how you will get her to talk about it. Mm.
And
Okay.
and here, please be in management. We should mention first, patient is unstable. So, is it allowed to tell her about the next step of management? Then, after I told her I will shift her now as urgently for saving her life. But
Mm, mm.
I want to ask you after shifting a couple of questions to know better. Now we are going to shift here, but please tell me more about what happened exactly. I think better to manage here first, then to discuss about the history, not the opposite side. To ask her about the history, then we tell her we are shifting here for because a life-saving situation
Yes,
and
yes, yes. I,
emergency.
I, I totally agree with you. The first thing is, in fact, in the first version of the question, I had mentioned that she is being shifted for a laparotomy, and you have to go and uh, talk to the mother. Okay, but when see the line says here, she has been fluid resuscitated, but needs to be taken for urgent laparotomy. Okay, she's been fluid resuscitation needs to be taken. So her mom is uh, wants to discuss with you a couple of things before. All right. So something right now you don't have any information about the patient, for example, suppose. Then in that case, it would be relevant to ask her about like medical, surgical comorbidities and allergies, etc., and shift her simultaneously. Of course, at the beginning of the task, you can signpost by saying that your daughter's condition is serious. It has been stabilized now, but she would require urgently to be shifted to the operation theater to manage, okay, via an operation. But before we go on to do that, I would like to ask a few questions and then you can proceed. Either ways,
Mhm.
it is fine. It's a 10-minute thing which is going ongoing, right?
Mhm.
You can say not an issue, but it would not result in like a failure in terms of patient safety, etc. There are many other
Mhm.
things here which are very big safety concerns here. One was to explore about the safeguarding issue, okay,
Mhm.
which was mainly designed in the heart of the task actually. All
And
right.
already the mother was suspicious about this, but she didn't open in the exam, ma'am, right?
I don't understand.
I think it was a hidden agenda for the mother. She didn't spoke
She's
up
not
about
supposed to tell you
safeguard.
about it. No, she's not supposed to unless you ask. She gives you hints. She says, she'll say, no, withdrawn. I'm worried about this. In fact, I kept repeating it. Whenever role player repeats something, please pay some heed to that. If role player is telling you, oh, I'm so upset about this, and you give counselor once,
Mm,
okay, they repeat themselves again. Don't give counselor a second and a third time again. It's not
mm,
working. Something else is
mm,
going on.
mm,
Okay,
mhm.
that's the way that you catch on. All
Okay,
right.
thank
Yeah.
you.
Hmm.
Hello, ma'am.
Hello. Hi.
If the mother says that she's aware of some abuse episode, how do we address that?
She's aware as in it has happened.
Yeah, it has happened. The daughter has told, but it was uh, she doesn't want to complain, or she wants to
What do you
suppress
think
that.
you should say now? Why are you asking me this question? Don't you know what to say? What will
Inform
you
the child
say?
safeguarding.
Yeah, you have to. There is no such thing as confidentiality when it comes to child protection. Okay, anybody who's below 18, your job to protect them, even if they say that, oh, I don't want to, or the mother says that she doesn't want to report abuse, that is not under their control at all. You have to say that it is our legal responsibility to inform the child safeguarding, and they will probably escalate or most likely escalate this to the police as well. But as far as you as a ST5 is concerned, the first point of contact that you will come to is the child safeguarding from the hospital. They will make contact with the police. So this is how you put the pathway
Okay.
forward with them.
Hmm. Yes.
Okay.
Thank you.
Okay.
Doctor, please, I have read about one station also the same, I think same scenario, but it was the husband of the patient who is she has ectopic pregnancy. So
Hmm.
is it allowed also to disclose these issues to your husband who was living in another country?
Again, it depends what the husband knows. How will you ask the husband?
Do you think that she is pregnant? She could be pregnant
Hmm.
if
Yeah.
he
Do you think
said this.
is it possible that it could be a pregnancy? Ask him in that way.
Yeah, but
He
if
will
he
tell.
knows, we can tell. But if he didn't know at all, so we
Then you
will
cannot.
not disclose, right?
No, no, no. You cannot say. See, the thing is that if he says, yes, doctor, we have been trying, and even if he doesn't know the fact that the UPT was positive, for example, okay? But he
Mm,
says that yes, we've been trying it. It is all aligning together. There is no information breach that you will do. If you tell, okay, she did get pregnant and then it resulted in ectopic which ruptured, you're fine there.
mhm, mhm,
However, if he says, no, I have been abroad, I have just come yesterday,
mhm, mhm,
that is a breach in confidentiality because you're giving him information that he is not privy to, he does not know.
mhm,
So you have to judge what confidentiality is in many situations. It is not as straightforward as saying that this is patient's diagnosis, we cannot tell this. It doesn't work that way. Okay.
mhm,
The next
mhm,
of kin person asking where they are already aware that she's they are as a couple trying to get pregnant, there is not going to be a breach of confidentiality. However, if a pregnant lady undergoes obstetric hysterectomy, which was something that was not discussed with anybody before, okay,
Mhm.
and she has as this point of time, it was an emergency situation and nothing else was discussed. All right, then in that situation you don't go ahead and tell the husband without discussing with the patient first what happened. You discuss with patient first, then you come and you tell the husband if she gives like permission. Usually in the exams in these situations it will mention that this is what has happened, and the patient has allowed you to speak about this or debrief this husband of hers, etc. They'll tell you.
Mhm.
Okay,
Mhm.
it will be very
Yes, yes.
clear there.
Okay, okay.
Hmm?
Thank you. Yes, okay, understand.
Okay. I guess if any other questions are there, please put them on the group. And thanks for being in attendance today. Okay, thank you, Dr. Forum, for
Thank you, ma'am.
thank you.
Thank you, ma'am.
Thank you.